Hey guys, Don here. Welcome to the $1 Million Minute, where I'm going to kind of go over what's been working for me to get to the $1 million mark and beyond, and I'm trying to help you get there too. I had a conversation recently with another doctor, and he was asking about my associate contract. So I was an associate initially for about 3 years, and then I bought in as a partner. We did a couple of different type of negotiations in the past. I know some people want to do they want to do 2.5 times what they produce and then give them 30%, and they're just kind of complex. What we found easiest for us is just to do a straight 30% of what the doctor produces. So if the doctor produces $1 million, then they get $300,000. It keeps it nice and clean. And then we pay for the other stuff. Like we pay for their malpractice, we pay for their health insurance, and other things like that. I know other people, they pay 35%, and then they discount health insurance and other things from that, whatever they choose to use. We just do a straight 30%. And then what do we do any like carve-outs? The only carve-outs we do would be really expensive stuff, like grafts that we would do. We would take those out. Okay. So let's go into this was the last time I did this one on a Friday, and so I had my routine time in the morning. Now I am training my new nail tech, and she is catching on. Really, she had a hard time because she's used to using her small little implements to trim nails, and we have these big old thick nails, as you know. So she struggled a little bit with that. And what I did is I introduced her, Marjorie, to all the patients. She came in with me. I did one foot, and then she did the other foot. That's basically how we did it, and I let her kind of practice. And then if she needed any help getting down to the nails. Now in our office, as I mentioned before, we only do a half day. So my half day is Friday morning. Other doctors do other half days, so she's going to be with the other doctors the other day for those half days. We do not grind. We don't file. We don't kind of cater to that. I know some offices do. That's great. We just don't. So she was wondering about that. We're not going to have her do that. She also knows how to do something similar to CariFlex, so we can send those to her as well as Ani fixes. The routine day was good. I saw a patient so I'll talk about what are the office visits that I did along with the routine. So there's a patient that came with Raynaud's, so we talked about that along with the routine. So that was these are all like level 3 office visits. There's another patient that we did a diabetic foot exam, another diabetic foot exam, another one. There's a patient that came with an ulcer on the right hallux. This was underneath the nail bed, so I did a kind of a partial nail evulsion where it was anecholytic, and then there was an ulcer underneath it, so I debrided that. So I numbed it up, did a partial nail evulsion, and then I debrided that ulcer. And then she also had nail care. And then another patient that got Naboso, which are toe spreaders. So we have 2 kind of toe spreaders in our office. One are correct toes, and the other are Naboso. Correct toes are about $65. Naboso are like $20 or $25. So they're a lot less expensive, and we offer both of them depending on patients' needs. And we usually recommend them with some type of an anatomic shoe. Another patient that came in with venous stasis changes, and I recommended a vascular referral. And then a number of these got ABIs as well. And so that was the morning. The afternoon, there was Cenxa. This is Cenxa number 4. So we've been doing Cenxa. If it's been number 4, it's probably been about a year now because we do those every 3 months. And this patient notably said that he used to use a cane to walk, and he no longer needed to use a cane. So he's having less pain. He's feeling better about that. Okay. Also, there was another patient that came in that had and I guess there was a couple of nail cares that I set up ABIs. There was a patient that came in with Lamisil with a rash. So usually when they have a rash with Lamisil, I stop the Lamisil and I have them start it up again. If it causes the rash again, then I will switch them to fluconazole or itraconazole or something else like that. So he's going to start it up again. If he has a rash, then he'll contact me. Another patient that came in for bilateral matrices, another patient that came in and got a night splint, And if they're not going to be if they're not better, then they're going to come back in. We're going to do Shockwave for that patient. Another patient that came in for nail fungus, I took a nail sample. They're going to be seen back in 3 weeks for the nail sample follow-up as well. The patient had some forefoot pain, and due to that, we're going to plan on scanning her for orthotics at the next visit. Another patient came in. This was a patient that she had 3 sessions of Shockwave on her neuroma, and she's felt much better with that, so no more follow-up for that. So I've done a couple of patients now for neuromas, and they've responded well. I do a lower amount of Shockwave, so focus Shockwave more and kind of a lower level to not irritate the nerve. And so I've had some, well, this one worked, not everyone works. Another patient that came in that had Swift number 2 today, and after Swift number 1, she got so much better. She said it worked like magic. She had seen another doctor before for about 7 months, didn't get better. They kept on doing the same thing. So Swift number 2, it almost looked like it was gone after the first one, but I still did a second one. And this one specifically, I've never done this before, but it was on her toe, so I numbed up the toe proximally, and I did the Swift on her. And I don't know if it's because I numbed it up that it worked better, or just because she was more susceptible to it, but she got better. And then she also had a nail issue, so I did a nail sample, and I'm going to see her back in 3 months for the Swift follow-up, and then I'll also go over the nail sample at that time for her. Another patient that came in for a nail evulsion, as well for a painful nail, and then the last patient was just a patient with a painful numbness and neuropathy. Anyway, that was the day. I think the best part was being with Marjorie, my new nail tech. I'm working on kind of training her in doing that role. The goal is to have some set of a sort of a parallel schedule with her, so she'll be treating and I'll be stopping in to see every patient. This is all new to us. We haven't done this before, but we're kind of trying it out. So if you guys have things that work for you, let me know. I know some people there's some kind of agreements and disagreements in this, and some of the concerns I've heard are, well, you're not supposed to have them do it. But I kind of think of, well, they're already doing Uniboots for us. They're already doing dispensing DME. They're already doing many other things for us. And if they are trained, so it's within their kind of their scope, it might be an okay thing for us. And we're going to be there for every patient. I guess we're going to kind of learn as we go. I'm hoping it'll free up our time a little bit more so that we could see other new patients. Anyway, that's the thoughts for today. We have 2 holiday weeks coming up, just so you know what we're doing on our schedule. So we're going to work Monday and half day Tuesday, and then we're off the other half day, which is Christmas Eve, Christmas Day. Anyway, we're off Tuesday afternoon, Wednesday, Thursday, Friday, and then the following week it's New Year's, so we're working. I think we're working half day Tuesday, and then off Wednesday, which is New Year's Day, and then we're working Thursday, Friday. So just in terms of the schedule, one of my other partners, he is off these next 2 weeks, so I think a lot of people are taking off at this time as well. Okay, have a great one. Wish you guys a good holiday season and New Year.